So I think I've met all of you, but my name's Annie. I'm the clinical educator for Birmingham Hospice. So the reason we wanted to run some of these sessions is we're basically trying to develop the workforce, develop our hospice as a placement provider. At the moment, we only have placements primarily in our inpatient units, and what we want to do going forward is expand that to our community settings, so that we can offer more placements and more diverse opportunities in hospice to gain experience with us. So UCB have kindly offered to take us through the sort of Assessor and Supervisor 101 of the kind of covering the basic topics that you'd need to know to support students. And then also their placement team are going to pop on at the end for about the last half hour and can just answer any questions that you may have about supporting students in your workplace, or any, you know, if you've had students before or in a previous workplace, any sort of tricky bits you've come across or queries that you've had while you've been supporting them. So thanks so much for your time, all of you today, and especially the team from UCB for giving up your time to run this. We are recording it, so hopefully you've all had a little thing pop up on your screen to say that this will be recorded. So you're welcome to leave your cameras on or turn them off, it's up to you. And then we will save that somewhere central so that hospice staff can access it after the event. It won't be available sort of publicly, it'll just be for hospice staff. So that's just to cover there. Okay, over to you guys. Thank you, unless I forgot anything, hopefully I didn't, but yeah, I'll hand over to you. Thank you.
Thanks, Annie. So we'll introduce ourselves first. So my name is Lydia. I am one of the nursing lecturers in the adult field. I predominantly teach second year student nurses, teaching them their clinical skills, but I also teach on the care of the acutely ill adult module. So my background is trauma and orthopaedics, but I've also done work in ICCU and accident and emergency. So that's kind of my background. And then this is my colleague.
So I'm Rosie. I'm one of the associate lecturers here at UCB. I mainly work with the first years and second years doing their skills and supporting the modules. I'm also a trauma and orthopaedic nurse. Yeah, that's me.
It's lovely to meet you all today. So the plan is that this is kind of going to be a little taster into your supervisor and assessor training, because the best thing for you guys to do, obviously, if you've had this little taster, is to do the e-learning for health package. I know it's a lot to go through, it's quite a lengthy package, but it will explain so much more than we can in a couple of hours. But we just kind of wanted to introduce ourselves to you. We're going to be your link tutors as well, so if you do have problems out in practice with your UCB students, you can drop us an email and we can come out and see you, or we can do a Teams if that's easier. Whatever you guys need, we're here to support. So yeah, let me just share my presentation with you. Oh, it would help if I was at the beginning and not the end. So I'm just going to turn my camera off whilst we are sharing, just so that we don't hopefully get any interference. So can you all see the presentation now?
Yes, yes, we can. Thank you.
Fabulous, lovely. So we've already introduced ourselves, so we'll skip over this slide. But basically, because we're teachers as well as nurses, we've got some learning objectives. So hopefully today we're going to introduce you to University College Birmingham, or UCB, and its nursing students. We're going to discuss the role of practice supervisors, practice assessors, and academic assessors. We'll look at levels of supervision and what they could look like out in clinical practice. We'll look at evaluating evidence, feedback, and common concerns that you might have with students. And we're also going to introduce or recap EPAD. I'm hoping the placement team will join us at about 3:30 to kind of go through EPAD. We've also got a little PDF document that we can share with yourselves that you can use as a source of reference as well, just in case you do have any problems. So if we start with a bit of an intro, so obviously we're University College Birmingham. We currently offer a varied programme in regards to health, predominantly nursing in adult and mental health, but we also do have physiotherapy. We're branching out into dietetics, paramedic science, and we're also looking at children's nursing. So we are growing, but we are still quite new in the field. We're just about to have our first graduation in September, which will be really exciting. So a bit of a course overview, just so you can kind of see what our students are going to be covering whilst they're with you. So we've got part 1 is our first year students. So you can see there the modules that they will do. So they cover 4 modules a year, as well as their nursing practice module, which runs all year. And then they also get 2 blocks of 6-week placements. So we'd expect them to do 432 placement hours within their first year, and simulation days would be 276. And then in the middle column, we've got level 5. So these are our second year nurses. So they do 3 modules, as well as their nursing practice part 2 module, which runs all year long. They have 3 6-week block placements in their second year. So in terms of placement hours, we'd expect them to achieve 576 for the full year and 360 simulation hours. And then we've got our last column, which is part 3. So these are our level 6 third year students. So they do 2 modules in their third year. They're quite lengthy, kind of detailed modules, so they only do the 2. And then they do 2 placements. One is a 4-week service improvement placement, and the other one is 14 weeks. So that looks more at their leadership and their management. So in terms of placement hours, we'd be expecting them to complete 576 in the third year, and simulation hours would be 152. Mental health is very, very similar. So it's just the modules that change, because obviously they have to be beneficial to our mental health nurses. But the first year, the adult and the mental health nurses are actually taught together. So they have the same lectures, the same kind of introduction to the world of nursing, which is really nice because they build really good friendships, and they get to that really good peer support. So this is just a bit of an example planner of kind of what a year looks like for a nursing student in UCB. So you can see it's broken down to 3 semesters. Our first semester is the top block there where it says block 1. Then we've got block 2. So this is where the first placement will start. So that starts at the beginning of semester 2. And then we've got block 3 where their second placement is. So this is a first year's planner. And you can see, obviously, they've got the 2 placement blocks, which are symbolised by the orangey yellow peas. We also build some annual leave in for them as well, so they're nice and rested between their modules or their placements. So just a bit of information about their delivery weeks and what they can expect. So they get 2 study days on university campus or online, which is blended learning. And they also get 1 day teaching and learning in our skills and simulation suite. They get 1 day directed e-learning, and then they get 1 day as independent self-directed learning. So they have 40 hours a week in university, and then when they go out into placement, they do 4 days in placement, which is shifts, weekends, bank holidays, nights, whatever they're needed to work. And then they do 1 day in the skills and simulation suite. So again, that is equivalent to them doing 40 hours. So in terms of what our students can expect from us as a university, they are taught by expert lecturers in the field of nursing, and we also invite our practice partners and our expert practitioners to come in and deliver teaching as well. They get varied and interesting placements inside and outside the NHS. They get fun and practical teaching sessions. Obviously, the course is very challenging, as everyone remembers from doing their own nursing training, whether it was 2 years ago or 20 years ago. It is very challenging, but it's incredibly rewarding. And then hopefully we've got lots of approachable, supportive and accessible lecturing staff as well. So in terms of our facilities, so what we can actually offer our students, we've got a purpose-built skills and simulation suite. We have a specialist learning environment that basically hopefully replicates real-life primary and secondary care settings. We have a 6-bedded hospital ward with simulation mannequins. We also have integrated filming and audio equipment, so we can actually film our students, or we can film scenarios and then they can watch them back and they can do things like risk analysis. And we've also got a virtual learning environment. So we've got an immersive room where we can display settings on the walls that they can engage with. And we've also got VR equipment. So we've got virtual reality equipment where they can assess patients in complex scenarios in a completely safe environment, which is a fantastic learning tool. So in terms of like clinical skills, so these are things that your students could be doing whilst they're with you. We have things like our essential patient care, so washing, dressing, toileting, mobilising. We also do nutrition and hydration. We do phlebotomy, cannulation. We do administering IV medications, and we do ECGs. We also do absolutely loads more. So we have things like catheterisation, bladder washouts, NGs, lots and lots of different skills. So like I said, they get 1 day per week skills training in our simulation suite. It's the same day of the week every year so that they get continuity throughout their 3-year programme, and they get over 400 hours in total within the skills training facility throughout their 3-year course. So we tend to usually do theory in the morning, and then we do some practicals in the afternoon where they can get their hands on and do some simulation. So in terms of like what we expect now and what you guys can expect when our students are with you really is we expect them to be fully committed. They know that they are doing a 40-hour study or placement per week. They sign a commitment statement when they join us, so they are fully aware that that is expected of them. And they also know that they get 7 to 9 weeks of holiday per year, and that is at set times, so they shouldn't be taking holiday outside of those weeks. We expect them to be hardworking, organised. We expect them to have really good time management. We expect full participation in class, and you guys should be expecting that out there as well. You should be expecting them to fully get involved when it comes to dealing with patients or handing over to staff, liaising with the MDTs. They should really get involved with every opportunity that's presented to them. Obviously as well, we expect excellent attendance, and we say that's the same out in clinical practice. We expect them to engage with their peers and do some group working, and obviously comply with the fitness for practice regulations and make sure they're working within the NMC Code of Conduct, and they are promoting their duty of candour as well. So I'm going to hand you over to Rosie now, and Rosie's going to talk to you about practice supervisors, practice assessors and academic assessors.
So the new NMC standards were released back in May 2018 following a huge consultation and incorporating the future nurse standards of proficiencies for registered nurses. They were generally split into 3 parts. So part 1 is the standards framework for nursing and midwifery professions. Part 2, standard for student supervision and assessment, and part 3, the programme standards for pre-registration nursing education and prescribing. So we're going to focus on part 2, the standards for student supervision and assessment. So why the change? In the future, healthcare professionals need to have knowledge and appropriate skills. So we need to enable them to meet increasingly complex health and social care needs, to deal with more complex models of service provision, and to be prepared to be the leaders of care and services in the future. So we'll just go through some of the differences that have come up. So the traditional mentor role is now being split into practice supervisors and practice assessors. All registered health and social care professionals can be practice supervisors for our nursing students. They don't have to be nursing staff as long as they're a registered professional. Practice supervisors preparation begins in the undergraduate programmes. So there's no formal course required. We do some training with our 3rd years so that they are able to support and supervise some of our 1st years and 2nd years. A practice supervisor can be, like I said, any registered healthcare professional. They just have to be competent in the skill that they are supervising. And a practice assessor even is the person that signs the competencies off for the allocated student and signs them off in their final year or final part of their placement. So back when it was SOM,
Yeah, sign-off mentor.
Sign-off mentors. All of the sign-off mentors now have become practice assessors because it's the same sort of training kind of thing. It's the same level of experience you need. Non-experienced staff, though, will require local preparation and the e-learning for health module. And there is no longer a ratio for practice assessors and practice supervisors to a particular student. There's no, you can have as many students or practice supervisors and assessors as doable on the ward. So there should be a local database of all the practice assessors and practice supervisors in the area, so that anybody can supervise our students or any of the other uni students. There's no cap on how many students can now attend different clinical areas. They've taken that out of the standards now. So then within the university, we've split the personal tutor role in two sort of. So we have our academic assessors who are more tailored towards the assessment and validation, and our personal tutor roles, which are the more pastoral support for our students. And then the practice placement management team, it's largely that role's not changed much. Yeah. Next one. So more differences for the students. There's no longer a requirement for a specific member of staff to be named a mentor for the students. They can be supervised by any practice supervisor during their placement, and they can be assessed by a nominated practice assessor. There is now no time regulations on how long you have to spend with a particular supervisor or assessor before they sign things. It's just when that registered member of staff feels comfortable and that they believe they're competent. Students don't have to stay with their personal assessor, their practice assessor even. They can work with others. They don't have to stay with their own. And like I said, practice supervisors, these anagrams are getting me. The practice supervisors can be any registered health and social care professional. So if they could do some time with the phlebotomist to get their cannulation or blood signed off, it doesn't have to be a nurse. It could be somebody that's competent in that skill. But the practice assessor must be a qualified registered nurse in the same field as the student. So if it's an adult student, it needs to be an adult registered nurse to sign them off. So the academic assessors, so we review theory and practice in conjunction with the practice assessors and practice supervisor feedback. Students are not to have the same the academic assessor through every year, so we have to change them every year so they just get a broad judgment. And then, oh gosh, I'm lost. So our students come out now following the future nurse standards as prescriber ready. So students will be equipped to begin their prescribing course once they gain their registration and they've got their PIN. So the way we assess them has changed slightly. We now have a regional assessment, which is called My EPAD, which is now an online electric form rather than the old style paper forms we used to have. So the overviews of the roles. So a student can work with anybody, they're everybody's responsibility. Keep going. Everybody's experience makes up that final student and that final student's assessment. So like I said, the traditional mentor role is now split into two, meaning greater assessment collaborations. So we all contribute to the final assessment, preventing failure to fail. All registered healthcare staff can support student supervision within their practical context, including our allied health professionals and unregistered staff. Students will be allocated a practice supervisor for every shift, so somebody who's responsible for that student throughout that shift. Students will be allocated and should be allocated a named practice assessor who will be responsible for proficiency sign-off part of their placement. And they'll be allocated an academic assessor with us every year. And again, that'll be different each year. So that means you could potentially have a different student for each shift, but keep your assigned students for your assessment points. They don't have to stay with one person, but it's one person that signs them off essentially. So the practice supervisor role is a registered nurse, nursing associate, midwife, or registered health or social care professional who is responsible for supporting and guiding the student through their learning experience in line with their scope of practice, facilitating student learning opportunities to ensure maximum benefit for the placement, serving as a model for safe and effective practice, recording regular feedback on the student's progress, including conduct, proficiency, and achievement of the required standards. They're also responsible for engaging with the practice assessor on the student's progress, so updating them on how they're getting on. So practice assessors and public protection. So practice assessors must ensure the supervision and support they provide protects the public by ensuring students are not placed with a personal situation outside their capability without suitable support, making clear that a person has the right to refuse having a student observe or participate in their care, acting as a role model for safe and effective practice in line with their professional code of conduct, raising concerns about any impacts to public protection from student learning takes precedent over the assessment. So the practice assessor role, responsible for joint proficiency sign-off for each part with the academic assessor, to raise concerns to nominated person or the academic assessor. So the nominated person could be practice placement managers or safeguarding, depending on the issues. Liaise with the practice supervisor and academic assessor for feedback regarding practical and academic progress. Validating feedback from other registered healthcare staff, so such as your AHPs. Leading supervision teams and student allocation to ensure best exposure to skills, so making sure that our students have got somebody that they can supervise them. Preparation for final assessment, including episodes of care, which I believe is part of their EPAD. Liaising with PPMs for advice and guidance regarding student support, and supporting the practice supervisors in their daily supervision roles, and maintaining quality educational standards to make sure we make the best nurses we can. So extended skills in Annex A and B. So this title actually, when you get the PowerPoint, links to Annex A and B of the future nurse standards so that you can read them yourself in your own time when you get the chance. So students will need to practice IV therapy, including blood transfusions, cannulation, venipuncture, using medical devices, chest auscultation, blood gas monitoring, if I could get my words out, blood glucose monitoring, and male catheterization. They obviously have to have done the theory and the practical training with us before they are able to do these skills out in practice. But they should be able to, they should understand themselves where they are with that. Students can be signed off using simulation in university, simulation in practice, including skills sessions, practice placement managers' counter signatures, observations by healthcare professionals experienced in the skill, such as phlebotomists, practice supervisors, practice assessors. Ooh. So if the students don't get the opportunity on their placements, because obviously not every placement area uses every skill, if they don't get the opportunity to pick up that skill out in practice, they have the opportunity to come back into university, and we'll do some practical sessions with them and assess them here so that they can still get that skill signed off, just in a different environment really. So the role of the academic assessor is to remain impartial and objective of the view of the student's progress within the My EPAD, get an overview of the student's theoretical performance, to gain practice feedback from practice assessor and or practice supervisors, and to ensure student practical performance over their placement part or over their year, which all makes up the final student assessment, so we can say if they pass their year 1, 2 or 3. So I'm going to hand over to Lydia for levels of supervision.
Okay, so I'm just going to talk a little bit about levels of supervision and what that might actually look like in clinical practice. So obviously levels of supervision will depend massively on what kind of students you've got out with you. They also depend on things like our university and our EPAD outcomes. So these need to be reviewed with your student during your initial interview. And then the initial interviews as well, just while we're talking about these, they can be carried out by a practice supervisor, and they just need to be countersigned by the practice assessor. So if you have, say, for example, limited practice assessors, but you have lots of supervisors, the supervisors can do your initial interview as long as it's countersigned, which is really good because obviously that reduces workload for some people. Obviously, they also depend on the student stage of learning. So this will depend on the student's year group and whether or not they've received the theory from us. Also as well, some students can be completing a retrieval placement, or they can be on a previous action plan from another placement. So it's really important to understand what skills they're missing or what skills they need to repeat if it's a retrieval. But if it is, if they're action planned, it's just about reviewing that action plan and seeing what we can do to support them achieving those goals and those skills. Obviously as well, sometimes it will depend on your student type. So for example, if they are cross-field or they're on a pathway. So some students move towards crossing fields for pathway experiences. So PAs, practice assessors and practice supervisors need to be aware of the students' fields, the type and the outcomes they need in regards to their supervision. So it might be for example, our adult nurses that we're currently training need exposure to paediatrics, they need exposure to mental health, learning disabilities. So they might arrange a pathway to go and see, to spend a day with the mental health team. So it's just being aware that our mental health nurses will also need adult exposure. So it's just understanding what they actually need and what kind of supervision, and whether it's the first time they've ever kind of dealt with an adult patient that maybe has got palliative needs or complex healthcare, and just making sure that they're fully supported. Also as well, we need to maximise independent learning, and this is maximised as the student confidence and proficiency increases. So as they get more confident and they start to progress towards the end of each part, so like the end of part 1, the end of part 2 and the end of part 3, we should hopefully see their levels of supervision starting to decrease, and they should be independently learning, and they should be proactive, as well as recognising their limits of competency and asking for help when needed to make sure our patients are kept safe. And just a point there as well, that it doesn't always mean that students need the same level of supervision even if they're in the same year. I'm sure you've all worked with students before, and you've worked with some students that are probably amazing. They're so confident and they understand exactly what's expected of them or what their patients expect of them, and they understand how to be safe practitioners. But you can have another student who's exactly the same year and exactly the same point in the course, but they just don't have that confidence yet. So they might require a little bit more supervision and a little bit more support compared to your more confident students. So, and then obviously as well, in terms of our public protection, So if you had any concerns regarding a student's progress or their level of supervision required, we can discuss that later in a bit more detail later when we're talking about escalating concerns. But if there is a concern, it's just about highlighting it as soon as possible so that we can action it rather than leaving it right until the end of their placement and then failing them. We need to make sure that we're acting immediately to support the students. So what does this mean in practice? So this is basically a little bit of an overview of our levels of supervision. So we've got red, which we've used for year 1. So this is guided participation in care and performing with increasing confidence and competence. Then we've got level 2, which is I've done as yellow. So this is about active participation in care with minimal guidance and performing with increasing confidence and competence. And then we've got level 3, which is our green. So these guys are ready to enter the register or almost ready to enter the register. So these should be practicing independently with minimal supervision. They should also as well be leading and coordinating care with confidence. So it's really important as they progress into their 3rd year that they do get leadership opportunities and they do start to manage more patients and really understand and experience the workload that's expected of them. So we'll just have a quick look at guided participation in a little bit more detail. So students are initially guided towards all the skills required to become a future nurse within the My EPAD or EPAD. And they have increased levels of supervision by a practice assessor or a practice supervisor during the first part, especially as some of these students are brand new to care. They've never worked in care before, or they've not ever had to care for potentially like sick relatives or siblings. So they are brand new, and some of them will require quite a lot of support to just kind of grasp the fundamentals of care, so just the basic needs of our nursing I was going to say nursing staff isn't what I mean, our patients. So it can include things like communication skills. It can also look at things like toileting, hygiene needs, brushing teeth, washing, dressing, maximising patient independence, those kind of skills. Obviously, the fundamentals of care are incredibly important. It's one of the building blocks of nursing, and it's really important that the students understand that it's really good if they can do an ECG, or it's really good if they can do venipuncture, but if they can't meet someone's basic human needs as a nurse, that's a failure. For us as a nursing profession, we need to ensure that they can really support our patients and their basic human needs. So obviously students should be allowed to practice the skills within the part 1 of their EPAD under the supervision of their practice assessor or their practice supervisor. And we would probably think that a student in their 1st year, particularly their first placement, might need a lot of guidance in terms of understanding what's expected of them, what they can achieve within their EPAD, what skills they can achieve. So they might actually need a little bit more support than maybe a 2nd year who can come to you and say, right, I need to do this, this, this and this. 1st years might just need that extra little bit in terms of how they can meet these skills, what kind of learning opportunities are available for them, how they can get things signed off. So obviously that means it's down to the practice assessors and practice supervisors to identify the skills that can be achieved and how the student can work towards them to make sure that they're documented and they get signed off in each assessment that they have. Ideally, students progress to the next level in the following part, but not always, because obviously some students don't achieve everything, or some students have problems in terms of conduct. If you do have any problems, like I've said already, apologies for repeating myself, but if you do have any concerns, if you've got a 1st year student and they can't perform at what you would expect as a first year student level, then please do, you can let myself and Rosie know, because obviously we're your linked tutors, but also on their EPAD, they'll have their academic assessor. So you can speak to the academic assessor directly. You can make a note on the EPAD and copy them into the email so that we can start putting a plan in place to support that student and hopefully overcome that difficulty. And then obviously we would want to action plan the student to make sure that the objectives are explicit, and we might need to bring some interviews forward or maybe do an additional interview if we did have concerns at that point. So in terms of the yes or no criteria, it needs to be achieved for all three elements of the EPAD. So it's split into knowledge, skills and attitude and values. So if they've achieved it, it would be a yes. So this class is a pass. So knowledge, basically, if you pass them, it means that they're able to identify the appropriate knowledge base required to deliver safe, person-centred care with some guidance. In skills, it would mean that in commonly encountered situations, they're able to utilise appropriate skills in the delivery of person-centred care, again, with guidance. And in terms of attitude, again, just making sure that they're demonstrating that professional attitude. So they're turning up on time, they've got correct uniform on, they're adhering to local policies, they're presentable, polite, courteous, etc. So they've got that professional attitude when they're delivering their person-centred care, and they should be demonstrating a positive engagement with their own learning. So they should be actively, with some support, looking for opportunities to meet the elements of the EPAD that need to be signed off. If you were to think there was an issue, so you were going to say no, that would obviously class as a fail. So in terms of knowledge, it would be somebody that, for example, is unable to demonstrate an adequate knowledge base, or if they've got significant gaps in their understanding, which leads to poor practice. So if they do something that's unsafe and you say to them, why have you done that? And they just can't answer you, they've got no kind of evidence-based practice behind them. So that's kind of what we would be looking at in knowledge. In terms of skills, again, when they're under direct supervision, they're not demonstrating safe practice or safe care, despite the fact that you might have already spoken to them about it, you might have already given them prompts, you might have already guided them through the task. So that would be a fail, because obviously it's poor practice and it's unsafe. And then attitude and values. So a fail there would be things like they've got an unprofessional attitude, so they're always late to shift, or they go MIA, so they go missing in action, or they don't turn up for their rostered shifts. They don't phone in to let you know where they are, because obviously that would be a bit of a safeguarding issue as well for us, and we'd be concerned. I'm trying to think of other examples, things like they're just rude, uniform's not correct, they don't adhere to like bare below the elbows, lack self-awareness, they don't ask questions, they don't engage with you, they don't engage with patients, basically things like that. And then if we move forward onto year 2, so this is our active participation. So at this point, students in their second part should have a good understanding of their roles and their expectations, in particular relating to the skills that they need to be able to achieve to be able to be signed off at the end of the second year and progress to third year. So at this point, we would expect our students to be advocates for their own learning and offer to complete tasks that they know are required as part of the patient's journey. They shouldn't require constant supervision and guidance for skills that have been completed in part 1. So if you do have a second year student, they shouldn't need that support anymore with any skill that's associated with part 1. However, it's always best practice for any practice assessor or practice supervisor to check that they're actually satisfied with the student's level of performance before saying, yeah, I'm happy that they can, I don't know, feed a patient, do a bed bath, do basic wound care without that supervision. So obviously students should also at this point, because they've stepped up a level and hopefully their confidence and their competence is increasing, we should be expecting them to take part in patient care for a number of patients in preparation for their episode of care assessment, which I'm hoping Shannon will talk to you about the episodes of care throughout the EPAD when she talks through that and explain what these are. But we would expect them to start kind of taking on a little bit more responsibility in terms of patients. And if you have got someone that's really confident and someone that's quite a competent student and you're happy with their level 1 skills, there's no reason as to why they can't supervise a year 1 student with year 1 skills if you are happy with that. So also as well, just to mention that some of the skills that are in year 2 don't have to be completed in year 2. We can actually carry them over to year 3. So if there isn't an opportunity, for example, for them to do venipuncture and cannulation at all in their second year placement, then we can carry it over to year 3 so that they could attempt to do it in their final year. And then, as Rosie said before, if they didn't achieve it within their final year, we would bring them back into university and we would sign them off as being safe through simulation, which has been agreed by the NMC, and they're happy for them to enter the register, even though it's only been that skill via simulation. So yeah, I think I've covered everything on there. So if I just move forward. So this is now moving into our final year. So this is our practicing independently with minimal supervision. So these are our third year student nurses that should be practicing their leadership and management, and they should be almost ready to sign their name to the register. And we basically want to get them as well prepared for being a nurse as we can, to make sure that when they do start that transition into a registered nurse and they do their supernumerary time, they are as well prepared as possible, whether that's skill-wise, whether it's knowledge-wise, whether it's emotionally, mentally. We just really want to make sure that they're really well supported. So this involves much more higher level acute skills for more complex patients usually. So we can have things like IV therapy and cannulation, but we can also start having a look at things like mental health first aid and CBT awareness. So the NMC are now very clear in terms of the future registry nursing standards that adult nurses need to have exposure to mental health. So at this university, we actually offer a nationally recognised course, which is the Mental Health First Aider for NHS England. And we actually put our students through this so that they can support someone that may be having an acute mental health crisis until more senior and more skilled support can arise. So these are also, like Rosie said before, in Annex A and B, and when we get the presentation, we'll send over the presentation to yourselves. There is a link that you can click and it'll take you directly to that, so you can have a read through and see what is actually expected of student nurses and how they should be ready to enter the register. So students at this level should be working independently with minimal supervision, but they should be, like I said, practicing those leadership and management skills. They should be taking caseloads of patients, which will help them in preparation for their final episode of care assessment and their final medicines management assessment. Ideally, clinical areas should be encouraging students to take, at this point, to take charge of wards. They can be planning care, they could be doing discharges, they could have complex cases, but they could also be doing all of that alongside supervising a year 2 or a year 1 student nurse. So it's really important that they learn about that multitasking role that obviously yourselves have out in clinical practice. Like Rosie says, in our final year, as part of their transition to professional practice module, we do our practice supervisor preparation training. So they should have an awareness of what's expected to them as a practice supervisor. So they should understand that fully and what they need to do to support their first and second year students. And at UCB, their final year OSCE is split into two parts. One part is regarding leadership and management, so we get them to lead a mock ward, and their first another part of that OSCE is actually teaching a skill. So we actually assess their ability to supervise clinical practice and to supervise a junior student nurse. So it is really important to encourage that actively whilst they're out in placement. So I've looked at supervision, so I'm just going to talk to you about tailoring our learning environment and just making sure that we are ensuring that we've got the best learning environments available for our students and that they're getting the most out of their time that they get to spend with you. So we want to enable and empower students to become independent learners. So students should be encouraged to seek out learning opportunities within the clinical area. They are all adult learners, so they are responsible for reviewing their learning outcomes and considering how best to achieve them in practice. Like I said previously, our first year students might need a little bit of an additional support with that and kind of maybe thinking outside the box on how they can achieve certain skills if it's not listed within, or it's not listed, sorry, if it's not covered within that specific clinical area. But by the time they get to year 2 and year 3, we would expect them to actively be looking at how they can meet their learning needs. It's not a practice assessor's or a practice supervisor's responsibility to remind a student to fill out their EPAD at all. They are responsible for their EPADs, so please don't feel that you have to do that for them. Obviously, as well, one of the best ways to empower our students is to develop a partnership with them, make sure that they encourage a deeper learning and they get that sense of curiosity. Make sure you're assisting the student to create clarity, a greater focus and an awareness of what they need to learn and how to create their own next steps and goals. So it's always a good idea to say to them, okay, so you've achieved this, what's next? What do you want? Or even on the initial interview, find out what they actually want from that placement or what they want to achieve, what their goals are. Also as well, a great way to encourage someone to become an independent learner is to not give them the answers. So if they do have a question, maybe ask them to do some independent research so that they can feed back to you what they found in terms of the evidence-based practice. It'll help them develop their critical thinking. And it'll also help them develop as a person because they'll be stepping outside their comfort zone and they'll be able to come back to you and they'll be able to feed back and then you can talk through whatever it is you've asked them to do. So it'll be a really good learning opportunity for them. So something else as well is utilising available resources and learning opportunities. So obviously the practice assessors and practice supervisors are the best people that have an awareness of the skills and opportunities that a clinical area can present. This also includes, like Rosie said earlier, your other allied health professionals. So whether it's a physio, an occupational therapist, a phlebotomist, a radiographer, and there's lots of different people that students can work alongside to get that cross-field work in and learn how the MDT works together. Also as well, your student link workers, so Annie, I'm guessing, would be the best person to help you in terms of what resources and learning opportunities are available. You could also do things like student notice boards if you've got forums running or if there's an opportunity to take a day pathway with a particular team. That would be a really good way to look at what available resources and learning opportunities you've got. Also as well, it's really important that you're aware of your students' learning outcomes and just review any prior learning that they've covered. So you can have a look at previous comments made on their pads from previous assessors or supervisors. Obviously, you can contact the university and ask us whereabouts they are in terms of their programme and what they've covered and what you can expect. So that will really help before you meet your students. If you have time, obviously, I can understand clinically it's not always possible, but if you can always contact us and we can let you know where they are in terms of their programme and their development. In terms of skill sets as well and like learning outcomes, obviously not all students have the opportunity to practice everything, and it's just making sure that you're only assessing skills that you've achieved yourself and that you're happy with. And obviously our students have to demonstrate the theory behind every skill that they perform, and they have to have evidence that they've attended university theory prior to attempting the skill. So this can be found in their ongoing achievement record, which is sometimes referred to as the OAR on the EPAD. But also the academic assessor can validate that for you. So if, for example, you've got a second year out with you and you weren't sure about cannulation and venipuncture, you can always drop us an email and we'll more than happily let you know whether or not that's appropriate for that student. Just to add on here as well, that not all students are forthcoming about their learning outcomes. Some of them can withhold things because they feel as though it might be a bit of a burden on the placement area if they kind of say, oh well, I've got all of these learning outcomes to go. So it's just really important to encourage them to share what they think they can achieve and maybe go through the pad with them and have a look at some of the proficiencies. So something else as well is about I can't talk now this afternoon, sorry guys. To do inclusive and tailored learning, it's about judging appropriate learning opportunities. So they only need to carry out tasks that are relevant to their year group, and they are aware of the things they can and can't do. And like I said before, they can share all of this information with you via their EPAD, or you could contact the academic assessor if you had specific concerns. Not all opportunities are going to be available. So say, for example, they come to you on their first placement of their second year. They won't have all of those learning outcomes available because of the service that you provide. So it's just making sure that they have realistic expectations and they don't expect absolutely to be able to do absolutely everything within their first placement, and then they do understand it is a year-long process and not everything has to be assessed all at once. So something else to consider in terms of your learning environments is just making being aware of the availability of other practice supervisors, assessors, their skills and knowledge, and making sure that you've chosen the right supervisor for that student. So the practice assessor is able to review the person best placed to supervise the student to achieve the skills that they need to, and they're obviously have to be competent to be able to sign off proficiencies. Like we keep saying, there's lots and lots of healthcare opportunities available. They can work with a lot of different people to meet skills that maybe yourselves cannot carry out. So yeah, just making use of the wider team if you've got access to them, or maybe just thinking outside the box in terms of how they're going to meet that need. And then the other thing is planning time to make sure that you're able, obviously, to assess the student that you've been assigned to. So obviously this depends on the placement area. It depends on whether you've got the skills that they need to be signed off, and it depends how often you can work with that student, because just because you've seen something once, that doesn't mean that you need to sign them off. You could want to see it a few more times before you actually sign them off, and that's absolutely fine. You do whatever you are comfortable with. So I'm just going to touch on equality and diversity really quickly, because that's a really important part of ensuring that we offer good placements to our students. So in terms of the Equality Act, We are obviously the accredited educational institute, and along with our practice learning partners, it's our responsibility to ensure that equality and diversity needs of all of those who are part of an educational experience are taken into an account. So this could be things like reasonable adjustments. So when you get this PowerPoint, the first link here for reasonable adjustments will take you to the NMC's little video that they did regarding reasonable adjustments. But the overarching message with reasonable adjustments is that they can be made to help a student meet a standard, but they can't be made to lower the standard. So we don't want to lower any of the competency standards, but we can look at how we can maybe adjust the way we do things in clinical practice to help a student meet that level of standard, that quality. We are aware that we have certain students that do need reasonable adjustments, and usually our students are very forthcoming and will speak to yourselves, or they'll say that it's okay for us to contact you if we do have students regarding that have conditions or learning needs that might mean that they've got to have reasonable adjustments. So hopefully once those are put in place, the students should thrive and they should be successful in achieving the placement. So in terms of like supporting reasonable adjustments, again, this slide here, if you click onto the link when you get it, it takes you to a YouTube video looking at how we can support those reasonable adjustments. So in things like obviously there are particular religions where they must cover all parts of their skin, and it's just about getting the student to understand that that's not possible within our clinical practice because we have our bare below the elbow. The one that I always think of is there was a case study, I'm sure it was in the media a while ago now, probably about 5-6 years ago, about a registered nurse who was asked to remove I think it was a crucifix or a cross that she wore around her neck. And the reason that she was asked to remove it, so the reasonable adjustment, was the fact that they were worried that a patient that was upset could actually pull it off, and or they could break it, or it could be a strangulation hazard. So it's just making students understand things like that we make adjustments to support them, but there are things that we can't adjust because it would affect their safety or it would affect the safety of patients. So I think the YouTube video explains it a lot better than I just have, but yeah, it's just about making sure that they understand that. And then it's just making sure if all adjustments can be met. So just to add that students aren't at liberty to divulge any personal disabilities. Most of our students so far within our 3 years have been really forthcoming and have explained to us what they need and how we can meet their needs. So hopefully there would be the same in placement. Unfortunately, though, if they don't come forward to it, you don't have evidence that they need that reasonable adjustment. So the clinical areas can't support reasonable adjustments if they don't have evidence. So I just recommend asking the students at initial interviews to ascertain what support they need, if any. It could be where the shift patterns they're working, it could be the fact that they might have specific childcare needs, or it could be other issues affecting their placement. So it's just about having that open and honest conversation really when they first start, so that they feel supported right from the beginning. And that's obviously the responsibility of the practice assessor and practice supervisor, is to have those open conversations and just check that we are supporting them as best as we can. If we are making reasonable adjustments, are they suitable? Are they safe? Are they keeping our patients safe? And are they keeping our students safe? So I'm going to move forward now to evaluating evidence, giving feedback and some common concerns that you might have whilst supporting students out on placement. So in terms of evaluating evidence, so first thing that's always a good point to start is what's your student doing well? So we're kind of thinking now that you're ready to like sign them off for that placement. So yeah, what's your student doing well? Obviously students absolutely love praise. It really gives them a massive confidence boost, which then helps them develop as a nurse, because they understand what they're doing is correct. They understand that the knowledge that they've gained is right. The evidence underpins what they're doing. So I think it's really important to praise them. Or if they've achieved lots of competencies as well, that's always a good thing to talk about. And I think as well as like knowledge and skills, it's really important to commend our students if they've got a really good attitude as well. So are there any areas for improvement? So this is really, really useful to students. People sometimes avoid it because they feel like it's overly negative, but it's not at all. It helps them develop both as professionals, and it will also help them develop personally. But have you had feedback from other staff, or have they given you some feedback? As your actual student said to you, oh, I've done this skill, but I think I could have done better, because that's an area of improvement. Even if the students identified it themselves, it's really good to include that. Also as well, if you do identify some areas for improvement, it's always a good idea to suggest ways that they can improve on that and things that they can change to make it more successful next time. Another question you might want to ask yourselves, if you're not at the site, but maybe you've got concerns, is do you need to bring the interviews forward? So do you need to bring their midpoint forward to kind of have a more formal discussion with them, rather than just waiting another few weeks to see if it gets any better? Also as well, just consider that if you are bringing interviews forward, it could, or if you don't bring an interview forward, more so, it could affect their final sign off for that year, and it could affect them progressing into the next year or progressing onto the register. So I think if you do have a genuine concern or a reason to reevaluate the student progress, it's definitely worth bringing that interview forward. So who would you contact? So obviously, if you had any concerns regarding what your students are doing, you can speak to your practice placement managers. You can speak to your academic assessors. If you're a practice supervisor, you would speak to the student's practice assessor. You could also speak to like the ward manager, the unit manager, whoever's in charge, basically, just to kind of talk it through and see what we can do to support that student and support yourselves as well, because that's really important that we support you if you are having difficulties with a student. So another thing to think of is their evidence and performance critically sound? So have you had an opportunity to question them, to ask them what they're doing, why they're doing it, what's the evidence underpinning the way that they've dressed a wound or the way that they've mobilised a patient? Are they aware of why they're doing things? So they're not just doing this because all the other nurses do it this way. Why do they actually need to do it in a particular manner? And then also as well, can they question practice that they're seeing, and can they make sound judgments based on the practice that they're seeing themselves? Because obviously we want to make sure that they're safe practitioners and they can spot poor care or they can spot areas for improvement, because that's what it's all about, making sure that we improve and we constantly develop to make sure our patients get the best care possible. So all of that evidence would inform the practice assessor's judgment for the final completion of the placement outcome. So when they come to the last sort of few weeks of their placement and they're ready to be signed off, to go to the next placement or to pass into the next year or to pass onto the nursing register. So just carrying on with evaluating the evidence. So the response responsible for sign off at the end of the student placement part or the end of the student year. So basically, is everything signed off? Has feedback from other registered staff been validated? Has the student achieved all their proficiencies, or has it been agreed that some are going to be carried over? That would have to be in agreement with the academic assessor as well. Have they passed their episode of care and their medicines management? And have you checked their ongoing achievement record? So setting regular student meetings during placement, so base, pathway or full placement, it depends upon the student's course or where they're at that moment, but it does include their initial, midpoint and final interview. So ideally PAs should be ensuring that the interviews are planned in advance and that the student is aware of when these interviews are going to occur. If you have concerns about like the main assessment points within the programme, you can speak to the practice placement manager or Annie, or you can speak to the academic assessors and we can support with that. So obviously the assessment should be based upon the supervision levels that we talked about earlier. So the first year should be guided, second year should be active, and third year should be independently practicing. So make sure you're assessing them against their level of supervision. You can document the level of supervision in the EPAD, and then if, for example, at the beginning of the placement, they might still be under guided supervision, even though they might be a second year student nurse. However, when they come to the end of their placement with you, you might think, actually, no, they've transitioned, they've become active now. So it'd be really important to document that transition as well, because it shows the student's progress, it shows their development, which is really good for us as academic assessors, because it means that when we come to sign the student off, we can see that transition, we can see that development. So there's a continual a continual review of the EPAD proficiency and achievement. So signatures, skills attainment, if they've been on a pathway, have they got feedback, have they met learning outcomes, have they got a good critical evidence base, have they got student observations of practice, and this should all be done by the student in preparation for their summative episode of care assessment. The outcomes are directly in the EPAD, and it's important to relate all skills that are going to be signed off to the student's knowledge, attitude, knowledge level and attitude towards the skill completion. You only need to sign the skills off when all three components have been achieved. So also as well, in terms of evidence of whether a student is going to pass or fail, you've got your evaluation of feedback and competency attainment from other healthcare professionals. So you can review all of the comments and feedback provided. And it doesn't matter how small the feedback is, whether it's a couple of lines, it should still form part of the final assessment and the final sign-off. And practice supervisors have a responsibility to ensure that their feedback is honest, legible and accurate, as they obviously will be part of the decision-making process for the student, which could lead to the pass or the fail. The other aspect that's evaluated in terms of our students progressing is medicines management. So they have a summative medicines management, which is like a sign off to say that they're safe to give medication, but they do also have formative opportunities. So they can have formative assessments, which obviously don't go towards the pass or fail, but it will help in developing the student's confidence and abilities. So it's really important that they are given appropriate opportunities to practice their medicines management. It doesn't always need to be by the bedside with a drugs trolley. You could think of other opportunities to give the student learning opportunities regarding medicines that are available in the area. You could set regular times for assessment in preparation for their final assessment if they are doing their sign-off meds management with yourselves. Because a fail in this area should not be a surprise to them. They students usually know that they're going to fail. It should never be a surprise. Like I said, those concerns should be addressed, escalated, highlighted as soon as we have them. So also as well, in terms of evidence for the student sign off, or just evidence for your students' progression, you can have a look at their ongoing achievement record. There can be academic information in there, there's practice information in there, and it basically captures the student's journey over the whole 3-year course. So it's really good to have a look at that in terms of seeing what your student has achieved so far, what they're progressing towards, how they're doing academically. And then also as well, we can use patient feedback. So it's critical to assessment to find out how students are getting on, because patients don't tend to sugarcoat much to us. So it's really, really important to get that that feedback from the patients. It's just important to note here that students need to gain consent from the patient. Once the patient's given consent, the comments or the feedback is actually anonymised. They don't have to put in their details, but if they want a patient to comment, then they're going to need their consent for that, and that's all done in the EPAD. And then also as well, they can have lots of different patients giving feedback. They could have different ages, they could have patients with different needs. So they should have a varied variety of feedback to make sure that they are showing off different aspects of what they've been able to achieve. So we'll just give a quick look at constructive feedback, because I know this is something that I definitely struggle with, constructive feedback. It used to be referred to as a praise sandwich, but we tend not to use that anymore. But it is sometimes really difficult to give feedback to people and not be really negative, especially if you do have something to tell them that's maybe not a positive. So just have a quick look at that. So obviously it's really, really important that feedback's given in a private environment, away from others, and obviously never in front of a patient, because if it is negative, it could make the patient worry about the level of care that they're going to receive, and we definitely don't want that. Also as well, students can become very, very emotional, especially if it comes as a surprise. So I always like to take a bottle of water and some tissues, and usually do it before they go on like a lunch break or like a break, just because you never know what's going to happen. So I think it's really important just to be prepared for that eventuality. And then just making sure that the environment is somewhere that they feel accepted and they feel respected, and they don't feel like it is going to be a personal attack on them. It's also really important to make sure that feedback's given as near as possible to the event, to make sure that we get the most accurate details on what's happened, and this can be done outside of the formative meetings that are on my EPAD. But like I said, if you do find your student is having difficulty, you can bring your midpoint interview forwards. But yeah, please do tell your students if you've got an issue. So it's really important with feedback that we remain in the present, we're factual and we're neutral. We don't ever bring in our personal feelings or personal judgment or gut feelings. So just make sure that any feedback, it's just relevant to the information. It's relevant information to the discussion. If you bring up things that have already been dealt with or have already been addressed, the student might feel as though those things have been sorted out, and they might feel it's more of a personal attack on themselves, and then they tend to turn off, and then they're not very receptive to future comments. Another thing to just remember as well is it's really uncomfortable for you both. Kindness and respect are my favourite words when it comes to feedback, because telling somebody that they're not doing a very good job it's an awful thing to do. I don't like it at all. but it is obviously part of keeping our patients safe and making sure our students understand what's expected of them. So just making sure that things like voice and facial expressions say a lot more than our words actually do. So it's really important to be aware of those when we're feeding back to our students. Just making sure that we listen to what they tell us. So listening with the intent to understand, not listening with the intent to reply. Yeah, just maybe trying to ask them how they're feeling about it, if there's anything in particular that they can think of moving forward that would help them process it quicker, or help them be able to get back to clinical practice. Making sure we allow time for the student to understand and question the rationale. I understand clinical areas are really, really busy, and setting time for feedback is sometimes really, really difficult. So I think it's important, though, that we do feedback in a time that we won't be disturbed, particularly if the conversation is going to become emotive. So if you do have a student that is going to become upset, or you need to give them some negative feedback or constructive feedback, sorry. So yeah, sometimes as well, if you've had a really busy, crazy shift, taking a few minutes with your student at the end of the shift and just telling them that they've done a really, really good job, despite the fact that it's been absolute chaos, it can really, really boost their morale, and it can make the difference for a student. It really, really can. And this is what our students are feeding back from us, those mentors that say at the end of the shift, "Oh, thanks for all your help today, you were fantastic. I don't know how they've done it without you, we've been so busy." It just makes them feel as though they're part of the team, and that's what we want for them. So obviously as well, feedback shouldn't be based on any unachievable outcomes or observations. So obviously the feedback should match where the student is in terms of their stage of the course. So it'd be really unfair to expect a first year student who's never worked in care before to work as well as maybe a first year student who was a HCA for 10 years before they came into nursing. So yeah, I think it's really important that feedback's individualised and it's not unachievable outcomes. Obviously, all of our students learn at a different pace as well. So although EPAD's great because it kind of standardizes everything, our students aren't standardized. So you might have two students that are very, very, very different, and it's just to bear that in mind that their outcomes are going to be different and the feedback needs to be tailored. It needs to be individual. So that covers the inappropriate comments regarding the student stage in learning, just making sure that you are aware of where they are in terms of their learning journey, and you're not comparing them to other students that maybe have got experience. Another really important part of feedback is just to ask the students to reflect upon their performance, review responses, acknowledge changes required, and then plan a way to move forward together. So basically, evidence suggests that the praise sandwich, which is where you used to say something good, something bad, and then follow it up with something good, it's no longer viable because people only tend to hear the last thing that you've said. So they will just take it as they're actually doing a very good job, or they'll just listen to all of the negatives. So instead, I tend to find it myself easier if I ask the student to open the conversation. So if I ask them to tell me how they think they're doing, and then maybe tease out the issues together, rather than me going in and basically being like, "Oh, well, you're doing this wrong, or this isn't correct, or I'm unsure about your ability here." I think they find it kinder as well, and they feel like they've realised the issue by themselves and they've just been guided through. And then planning together is a really fantastic way of making them feel like they're part of the team, giving them that independent learning, promoting them to be an independent learner as well. So that's really, really good. And obviously reflection is a massive part of the NMC Code of Conduct, so it's really important to kind of embed that as much as we can. So if you had any concerns in practice in terms of your students, things like their level of proficiency or their conduct, then like I said, you could speak to the practice assessor, or if you are the practice assessor, you could speak to your clinical educators, your PPMs, your managers. You could contact us as the academic assessors. But basically, we need to be informing the students of the concerns that have been raised, and these need to be documented in their EPAD. We need to make sure that we're doing regular feedback meetings, and we also need to think about contacting the academic assessors and creating an action plan to make sure that these the students have got those outcomes to work towards and to kind of turn themselves around and not fail the placement, because we definitely don't want failing students. We want to support them as best as possible to develop. So in terms of failing students, so fails will occur when students fail to achieve the correct level of knowledge, skills, or attitude within the EPAD at their specific supervision level, despite action planning. So failing is kind of like a last resort. We really want to do as much as possible to support our students and to help them turn around rather than failing them. So for example, you can see in red there, it says a fail would be is not able to demonstrate an adequate knowledge base and has significant gaps in understanding, which leads to poor practice. So if you do need to fail a student, it's really important that you remove emotion from the decision. You're assessing a student against proficiencies in an EPAD. Don't take anything personally. Even though a student might be upset and you might really like your student, if they haven't achieved their proficiencies, they haven't achieved their proficiencies. Because at the end of the day, you're acting as a safeguard to the public and to ensure the safety of patients. So that's what really matters. You need to ensure the assessment processes are followed, the students informed at the final interview of the fail with a practice assessor and the practice placement manager. The academic assessor can also attend these as well if needed. That would rely on yourselves whether or not you wanted support from the university. But it shouldn't come as a surprise to the student at the final interview. They should know that there's been issues throughout and that feedback should be regular. And students can repeat the same placement areas. So if they do fail a placement area, they can return to get a retrieval placement to make sure that they can get those skills signed off, the proficiency signed off, and so that they can complete their hours. So a quick whistle-stop tour of action planning. So in terms of action planning, they need to be written in conjunction with the student in the EPAD as soon as the issues arise. So yeah, don't leave it for somebody else to do. Again, practice placement managers can give support with this. The university can give support with this. If you need anything at all, please do let us know, which is what that says there. So students need to understand the main areas needing support. So it's about making sure those action plans are clear and that students understand where they're failing and where they need to improve. They should be written using SMART objectives. So that means that they're specific, measurable, achievable, realistic and timely, because this is the best way to support our students to improve. And obviously they should be relevant to the EPAD, not based on personal feelings or gut feelings. And then also having regular review meetings will help, ideally weekly, but obviously I'm aware that clinically that's not always possible because we do get very, very busy. But the more review meetings, the better, because the student you can really track student progress. And the action plan is carried through the year to the final placement and can be used to support a pass or a validate the fail. So if a student is action planned in their very first placement of their very first year, then that will carry all the way through to the final placement of the first year, so that they can use it as evidence as to whether or not they've developed. So practice assessors and supporting others. So just kind of expanding the role what Rosie talked about in terms of the practice assessor's role, it's really important to realise that practice supervisors and practice assessors are responsible for supporting all, like the whole team, including students that might not even be yours. Creating a supervision and assessment teams is a really good, useful, I can't talk, sorry, is a really good, useful tip to have, because then the students who are aware of who is a supervisor, who's an assessor. Obviously off duty plays a massive part in that. In making sure all students assigned to you are supervised appropriately by those who have the right skills to teach, including our allied healthcare professions. So yeah, as an assessor, it's your responsibility to kind of match up who works with who, and that could be using physios, occupational therapists, phlebotomists, speech and language, lots of different ones. If you do have issues raised to you, it's really good for you to follow up to make sure that other practice assessors are supported, or students are supported, or supervisors are supported. Obviously as well, it's your job to be a role model to ensure the clinical learning environment is supporting your students. This really works with helping boost staff morale, because if students feel supported and your staff feel supported by you acting as a role model, it'll really help boost morale in those areas. Oh, sorry, that was a bit too quick. And then obviously being an amazing educational environment will also help support your recruitment, because the more students you have, the more chances that the word will get out that you've got an amazing place to work. This will then help support recruitment in future. But also, you're going to have, the better the educational environment, the better care your patients are going to receive, because they're going to have all of those opportunities available, and they're going to develop fantastically as student nurses, and then your patients are going to get fantastic care. So just to finish off, whilst we wait for the placement team to join us, I've just got some myth busting to go through. So me and Rosie have talked far too much for the last hour and a half. And I'm sorry if any questions have come up on the chat and we've missed them, because we've not been able to switch through screens. We've been locked into the presentation, but we can do Q&As in a minute, or I'll read through the chat if there is any there. And hopefully you've not all fallen asleep and been bored by us talking at you for an hour and a half. So anyway, yeah, your turn to get involved. So I've got some myth busting for you. So I'd like to you to tell me whether these are true or false. So students are not allowed to perform venipuncture on patients.
So I'm going to shout out. I'm still here. I'm still here. It was a really good presentation. Thank you. I've got loads of questions written down, so we can go through those in a bit. So I would say that is false. They are allowed to, as long as they've done the theory at uni first, and you are happy that, and you yourself are, as in the supervisor, is competent in that skill. So that would be my answer, I think.
Perfect, gold star. Yeah, that's completely right. As long as they've done the theory in university and they've done the simulation hours, and the supervisor or the assessor, or whoever is supervising them, if it's an AHP, as long as they are competent in that skill, the students can perform venipuncture. So what about students cannot take on any form of blood glucose monitoring? True or false?
I guess the same, really, as long as they've done the theory and the simulation at uni first, and the person supervising them is competent. I guess they also need to understand the follow-up from it if they get a reading, like an abnormal reading, what they need to do about it. So as a supervisor, you'd want to check that they know that. And I guess the other thing would be those, whether it's the patient's own monitor, it's sort of attached to them.
Yeah.
I don't know whether the training, the theory that they have would cover that, or that needs to be patient directed. I'm not sure. So that would be my query on that.
Yeah, so they can do blood glucose monitoring, again, as long as they've done the theory and they've done the simulation. In terms of patient-owned monitoring devices, we do not cover those. We just look at your normal standard blood glucose monitoring, whether that's kind of like the community-based ones that you see in pharmacies, or whether it's ones that they're going to use in trust.
Okay.
So it might have to be patient-guided, but they should also, because they've had the theory, had the knowledge of what needs to happen if a reading is out of range, whether that's low or high. Fab. So next one, students will be allowed to supervise other students completing skills without another practice supervisor present.
I'm not sure on this one. I don't know if Lynn or Steph has any ideas, but I would say third years, you did mention that third years could supervise first and second years because they're preparing to obviously go into practice and then be practice supervisors themselves. I don't know if you would, I don't know whether you would say it was okay for them to do a skill without another sort of registered member of staff present, like say phlebotomy or something. I feel that probably wouldn't be a good idea, but I don't know. I don't know what the rules are. I'd check with the uni. That'd be my my action. Check with the uni.
That sounds like a very good plan. I like that plan. But yeah, so students that are in their final year and have been deemed competent in the level 1 or level 2 skills and have also completed the practice supervisor preparation course are able to supervise year 1 and year 2 students completing a skill.
Okay. That is good to know.
Okay, allied health professions can sign student competence at the end of their placements.
So I know they can definitely sign off the skills if they are competent to do the skills themselves, or if they're working in that field themselves. For example, I don't know, physio might supervise a student doing some manual handling with a patient or something. The end of the placement, I guess, would be more the practice assessor, and that does need to be a registered nurse, doesn't it? So I'd say for that part, no, it needs to be a practice assessor who's a registered nurse on the same, oh, that was it, on the same bit of the register as the student. I remember that.
Yeah, that's perfect. So yeah, exactly what you said. So the allied health professionals can sign off the skills or the proficiencies that have been achieved, but they're not responsible for signing off the end of part of the placements. That is the practice assessor, who again must be a qualified nurse, and they must be qualified in the same field that the student is training for. So students can take blood gases using an arterial stab method.
So I have, was this on the thing? There was blood gases were mentioned, and then blood glucose was mentioned as skills they have to do. Can't remember whether it said arterial or venous, or it didn't say. So I know blood gases was mentioned. That's definitely a skill they can do. Myself, I trained like 10 years ago, and we were not allowed to do any of these things. It was very much stopped from doing anything, any kind of clinical skills at all. So it's very different. So I'm not sure for arterial, I don't know whether that will be an additional like competence that you would need to do when you're qualified. To be honest, I'm not sure. Again, I'd ask the uni if I wasn't sure. That would be my case.
Yeah, so right again, so the arterial stab for a blood gas is a high risk extended role, so it's definitely not something a student should be doing. The actual skill is interpretation and management of blood gases.
Okay.
So that doesn't mean that they should be taking them themselves, but rather maybe interpreting the results and maybe suggesting potential management plans.
Yeah.
But yeah, don't be letting your students do arterial stabs.
They're quite, it took me a while to train on to do them, so I'd be scared of letting a student anyway.
Yeah. So next one is students will be able to use medical devices for the administration of fluids.
Yeah, I think so, as long as they've practiced it in uni. I guess the thing would be which medical device is being used, so whether they've practice with that, say it was an IV pump, whether they're actually aware of that particular brand and everything of the IV pump, whether they'd need to do some additional training on the particular make of pump. I guess the theory of it and the simulation they might have done at uni generically, but yeah, that would be my question about the actual type.
Yeah, so they can, but like you quite rightly said, they might not be familiar with that pump, so they might need some in-house training. So a good example of this is City and Sandwell, so Sandwell and West Birmingham Trust. They are aware that our student nurses are trained to cannulate and to do venipuncture. However, due to their governance, our student nurses have to attend their training session. So they have to attend another theory day, and more simulation before they're allowed to cannulate or take bloods from a patient within that trust. So it depends what your local policy is. If they need to attend an additional training session, book them on it, and they can do it.
Okay, I've just noticed actually that Shannon is here.
Oh, fab.
In the meeting. So if oh, hello. Sorry, I just saw your name. Oh, you're just muted there, Shannon. Sorry.
That's fine. I'll stop presenting because it was just a bit of a game at the end.
Oh, that's fine. Sorry, Lydia. I was here a little bit early, but I thought it was quite important to do that bit, so that's fine.
No problem. Right. I'm not sharing my screen anymore, am I?
No, I'll share mine for my presentation, if that's okay.
Yeah. I'll just take the spotlight off you, Lydia, so that Shannon's the main person.
Fabulous.
Hopefully she will be. Yeah, great. Thank you.
Are you able to see the presentation?
Yeah.
Perfect. Okay, so I'll get started then. Hopefully I won't keep you too long, as Lydia's mentioned how long you've been on the call already, but feel free to pop questions in the chat box as we go along, and at the end as well we can have a little chat about EPAD if anything comes up throughout the presentation.
Sorry, you've just muted again then, Shannon. Sometimes mine does it when I press spacebar by accident.
Yeah, I was gonna. Yeah, can you hear me now? Sorry.
Yeah, I can hear you now. Yeah.
I think I did press space. I was trying to press enter to. It keeps doing it when I press enter. 2 seconds. Let me try something different. No, it's not going to let me move on to. Oh, okay, I'm going to have to press space. Right. Okay. So sorry about that. So what I'll cover in this session is talking through the technological side of EPAD and how you can access it, and how we expect the students and the staff to work together to get the assessment completed. So the EPAD is just the electronic version of the previous MyPad, which some of you might have been familiar with if you've had students before that came out with a paper document. But things have moved forward slightly, and the region in terms of Birmingham and Solihull, we've all moved towards using an electronic version, and we hope by doing that it all being on the same sort of version will mean that it's not new systems that people have to learn between different universities, but also it's a little bit more safer in some ways in terms of getting things signed off by people that are appropriately qualified, rather than documents just being signed off by people that perhaps aren't got the correct qualifications and things like that. So as I've mentioned, all HEIs within the Birmingham Solihull area are using EPAD. So if you have students from Birmingham City University, UOB, and new areas that are coming on board at Aston University and Newman University, you should hopefully be presented with the same document. And although you'll have different logins for the different universities, the documents should look exactly the same. All parts of the EPAD have guideline sections, which are quite often overlooked, but do just take some time with each section to read the guideline, and that will help remind both the student and yourself as assessors or supervisors what needs to be completed as part of the programme. So all parts of the EPAD can be saved as you're going through the document, and they don't need to necessarily be done in one sitting. So that's a great benefit of the EPAD system, sometimes with a paper document, you might have had to sit there for however long to get things completed with the student. But once the student has linked the assessor and the supervisor to certain aspects, it can be done independently of one another. So that is one of the main benefits. And just to note, students can revoke or resubmit sections if they've been rejected or awaiting a response. So again, it's quite easy for the students to change things if they aren't quite up to scratch, or they need to add elements in.
I think Shannon might have gone. Hopefully she comes back. We'll just give her a couple of minutes. I don't know if it looked like she was about to go on to the next slide, so I don't know if it just booted her out for some reason, so we'll just give her a couple of minutes to come back. Oh yes, there she is. Hello.
Hello, sorry about that. I pressed enter again and it's just logged me out. I don't know why it's doing that. Let me just share my screen again and hopefully it won't happen again. Okay.
Yeah, I can see that.
Okay, let's just get the PowerPoint back up. And let's just move this slightly out of the way. Okay, so I'll just go back onto the main screen again. Okay, so Lydia might have already given you an overview of how our placements work, but again, you'll be able to have access to this presentation for future staff and for you to reflect back on if need be. So in terms of our placements, in year 1, students have 2 placements, year 2 they have 3, and year 3 they have 2 placements. So we try and split students into being in different environments and learning different skills. So for you guys in your organisation, you might have students from any one of those years. Obviously we work with you guys to know which students are appropriate for which area, but certainly it might be that you have a year 1 student on one occasion and a year 3 student on another occasion. I know previously we've had a couple of year 3 students start with you guys, and they've had a great experience, and hopefully we can continue to develop that with other students from different cohorts. Just to note, with the EPAD, it's split into the 3 separate parts corresponding to the year of study. So when you have a 3rd year student out, for example, you'll be able to see what they've done, what placements they've done in part 2 and part 1. Whereas if you've got a part 1 student, obviously you'll only just see that part 1 section. So that is another added benefit of the EPAD there. If I move on to the next slide. Right, let's just do it this way. Okay, so signing into the EPAD. So ahead of signing into the EPAD, if you're a practice assessor within the organisation, we ask that your organisation sends us your email addresses ahead of the placement so we can get you onto the system. And once you're onto the system, you can log on to ARC and click the reset your password section, and what that will do, it will send an email token to your email address where you can set your own password up, and then you'll be able to have full access to the EPAD. But as I say, it's really important that the organisation sends us that email address ahead of time. Otherwise, we've had instances where students have been on placement trying to get things signed off, but actually their PA is not set up on the system, so it can just delay the student linking parts of the EPAD to their PA. So moving on to the next slide. Once you sign in, you'll be able to see an introduction to the EPAD, which is this screenshot here. And these blue boxes all give you a different guideline about the EPAD based on the role. So, for example, clicking on the student responsibilities, that would be the student looking and knowing what their responsibilities are towards the EPAD. And again, you can click on any of those and have a little bit more detail and guideline about that PAD document. And then over onto the left hand side, you'll have sort of 3 dashes here, and that will bring you up your main menu. And when you're assigned a student, or when a student's linked to you, you'll be able to go and view that student's EPAD by clicking on the student section over here. So if we move on to the next slide, it's just important to note that as practice assessors and practice supervisors, there's certain elements that can only be signed off by a practice assessor. So the students can get their orientation and initial interview signed off by a supervisor, as well as their standards of proficiencies. But it would be the practice assessor that needs to verify and sign off their midpoint, their final interview, their episodes of care, medicines management, and their ongoing achievement record, which Lydia touched on, which I saw Lydia touch on towards the end of the presentation. So with that in mind, all placements, all interviews need to be completed. So the orientation should happen within the first sort of day or 2 of them being on shift, and then we aim to have the initial interview signed off within the first week, and then midpoint halfway during their placement, and then their final interview on their final week. The majority of UCB placements are around 6 weeks in duration, so your midpoint would be at around week 3, and then the final being at week 6. The only exception to this is in our 3rd year students, when they're on their leadership and management placement, that is slightly longer, and so you just adjust that midpoint interview accordingly to that placement. So if we move on to the next slide, in terms of your interviews with the EPAD, sorry, I'll just go back a second. With the EPAD will only show up the next interview section once the section before it has been completed. So for example, the student couldn't go and put in information about their midpoint if they've not got their initial interview signed off. So it just aims to try and keep the student on track and knowing what they need to do next, and following that process. So in terms of the interviews then, once the student has had guidance from their PA or PS, they can complete their current interview section. And once they've completed all those sections, the student then should submit that to their PA or PS. What will happen is on the EPAD, the student will input their sections and then they'll click submit, and they can go in and either, if it's a practice supervisor, they'll need to know the supervisor's email address and they'll go and put that in themselves. If they're a PA, they'll be pre-populated for that placement area on our system, and that's why it's important that we know who the practice assessors are for that placement area ahead of time, so that it's on the EPAD ready for the student to link them. Once the student has linked or typed in who they want to send it to, the PA or PS will receive an email, and it will come in the form of a token, which is similar to this screenshot here on the right, and it will say which student has submitted their initial interview, and it will also give you a direct link to go and click on that link, and it will take you directly to that initial interview page, so you won't need to navigate the system so much, because it will take you directly to that page. And again, it's just important to note that for all aspects of the EPAD, it's heavily reliant upon the student leading and being responsible for their EPAD. They need to link sections to their practice supervisors or assessors, and as soon as they've done that, the practice assessor will always get that notification via email. I would say the majority do go to the inbox, but if you're having any issues and students are saying that they're linking elements and you're not receiving something, then I would just say just to double check your spam and junk folders, but generally they do go to the main inbox. So moving on to sort of verification and amendment. As a practice assessor or supervisor, quite often once you link to the page that you're signing off, the screen will give you an option to verify the section, or it'll ask you to or if you're not happy to verify, you can always click the not verify button, and you can provide some comments in the green box as to why you're not verifying it at that point. So for the initial interview, it might be that your student hasn't added in an important aspect of the conversation that you've had, for example, or one of their SMART goals that you're wanting them to achieve. So you can always write that in there, and that provides the information and context to the student so that they can make adjustments and resubmit that interview. Moving on to the midpoint and final interviews. So the midpoint and final interviews, as I previously mentioned, can only be signed off by the practice assessor. So it might be that the practice supervisors have done the first aspects, but at this point, they really need to be sending it to their assessor or knowing who that assessor is so that they can complete that in a timely manner. In terms of the midpoint and final interviews, again, it's led by the student. The student is required to fill in their self-assessment and reflection on progress over here on the right-hand screenshot. And once they've done that, they can link it and submit it to their practice assessor. The practice assessor will then get that email token, which I've showed previously, and it will take them straight to that midpoint page where they can then add their assessor comments in. And what we'll also ask is that you complete the mandatory professional values section. They're all a drop-down menu, and you go and toggle whether they've achieved it, yes or no. I think Lydia touched on action plans, but if any professional values are not achieved at that point, then you should be putting in an action plan. An action plan, again, can be created on EPAD. So if I just go back to the first slide, where you have your menu. So on your menu, you can see sort of halfway down, you've got a communication section, and within that section, you've got your action plans. So you would go into that action plan section there, and it would come up with a button that says create new action. So over here. And then you would type in, if it hasn't already linked to you, to the student that you're wanting to, this drop down here would give you a list of students that you've previously been linked to. And then it would link to that EPAD, and you would write the nature of the concern, what the student needs to demonstrate, and the support available, and who is responsible for monitoring that progress of that action plan created. And then you would also put in that when that deadline or that action plan needs to be met to be able for the student to progress. These action plans can be viewed by the student, by your practice managers of the area that are also linked to the student, and back in the university by the academic assessors as well. So it's a document that can be easily accessed and viewed by those that are required. Moving on to the standards of proficiency. So in terms of students, again, it's led by the student inviting supervisors and assessors to sign off those proficiencies, and the student will be linking, or could be linking, multiple supervisors and their assessor to this document. So the main difference of the other sections is where it will take you to the exact page. The link and the email token will take you to this page, but of course you would only be signing off a proficiency that you've assessed or viewed. So it won't take, the student doesn't link you to one proficiency, they link you to the whole document, if that makes sense. So you would just, as I mentioned, just locate the relevant proficiency. So if it's proficiency 1 or 7, for example, and then you would go and put in the date that you've assessed that proficiency and whether they've achieved it by ticking the yes box or the no box. It's really important that you don't enter anything if the proficiency has not been attempted. So, for example, if you've done proficiency number 2 but not number 1, you would just leave number 1 blank. You would only tick no if they've attempted it and not passed it. Okay. Hopefully that makes sense on that one. So moving on to episodes of care. So again, the student would navigate to their episode of care menu on the left-hand side, and you'll see that it's split into formative and summative sections. Now, the formative is a trial run, whereas the summative is almost like the final exam and what they're assessed on, and it will decide if the student has achieved that episode of care or not. We always recommend students to complete a formative. So, for example, in year 1, when they've got 2 placements, we recommend that their first placement, they act as a formative placement, and then their final placement is a summative placement. But as the EPAD's a year-long assessment, the formative is not a mandatory requirement. So although we recommend students doing it, if they haven't done it or decline the right to do it, then the mandatory is just completing the summative. And with the summative assessment and the formative, there's 3 text fields for the student to complete before submitting to their PA. So what they would do is describe the episode of care and what they felt they did well and what they felt they could have done differently on reflection, or if they were to reattempt that episode of care. So if I move on to the next screen, you'll see some screenshots of what the practice assessor would then be signing off. So you, as a practice assessor, you would provide feedback on that episode of care by toggling yes or no to the standards of proficiency for that episode of care. And this green box over on the right hand side, you can provide again further detail or feedback as required. Obviously, the more information you pop in, the better for the student from a learning point of view. But these comment sections aren't mandatory to type in, but the toggle sections are. Once you have completed all feedback, the practice assessor would then need to return it back to the student by clicking save and mark as completed, or you can see this button here, reject and return to student. So again, if you wasn't happy with the level of information the student has input, you can always reject it, write a comment as to why you're rejecting it, and that student will receive that notification immediately. Again, all sections, once you're done inputting your information, if you're verifying or approving a section, you would always tick save and mark as completed. If you're on the ward and you're trying to get the EPAD done in between the day jobs you've got going on, say if you get pulled away, you can always save it for later, so it doesn't necessarily have to all be done in one sitting. And again, that's another benefit. You can come and go as you please with it, really. So moving on to medicines management. So again, very similar format. The student will go and select their medicines management from the EPAD menu. Again, it's split into a formative and summative section, and just like the episodes of care, the formative is still that trial run, and the summative is a mandatory element of their assessment across the part. The students again will need to link their PA to this section to enable sign off. So it's very heavily reliant on that student being responsible and getting their EPAD sections linked to the relevant staff member. As a PA, once you're attached to the medicines management section, you'll see a screen that looks like the screenshot over on the right here. So I'll ask you to tick whether the student has achieved the competencies relating to the medicines management, and you can go and do that by ticking yes, and it'll highlight blue like it has down here. Or if they haven't passed that competency, you would tick no and then save and submit that back to the student. There are other sections on the EPAD, such as records of communication. So that will enable you to send email communications to the student or the academic assessor that is linked to that student's EPAD. And what happens when that record of communication is sent, it almost creates like a notification email to your email inbox. So the recipient of that email won't necessarily be able to see what is said on that on their email into their inbox, but it would give them a notification to log onto their EPAD to view what has been said. You can also see a summary of previous emails and communications sent on that section. So if you're regularly communicating with the student, or the students communicating with yourself to try and get things signed off, a record will be kept in that section. So next section, there is a cross-field and interprofessional working section where students can document reflections, and these can be viewed by the PA. Students are encouraged to do that throughout their placements, and although it doesn't impact on their ongoing achievement record, it is a section that is encouraged. There's also a file store section within the records of communication where staff and students can upload files that supplement their assessment. So, for example, this might be if the student has received feedback from a patient, or a thank you card, for example, and they want that to be reflected on their EPAD, they can take a picture of that and upload that like you would upload any other file to a computer. The end of placement and end of part OAR is a really important section that is to be used at the end of their year, if that makes sense. So there is 2 sections, and quite often students get confused. So it's really important that the student and their PA are aware of what placement they're on and what needs to be signed off. So the end of placement OAR is pretty self-explanatory. It's at the end of that placement, and the end of part is their final placement at the end of the year. So again, for year 1 students, it'll be on that 2nd placement, whereas for the 2nd year students, it will be on that 3rd placement. So it's just important to know where the student is at in their year assessment and which part needs to be signed off. Students should only link their PA to the end of placement OAR if, as I said, if they're in that 1st placement, but if they're on the end, then it would be that end of part OAR when all sections need to have been fully completed. Now, the important part about the OAR is that it's pre-populated and pulls through results from the assessments approved before that. So if you have a student that you're trying to get everything sort of signed off in the last week, which hopefully is not the case, but if it is the case, you just need to make sure that all sections have been approved and signed off before that section is linked to the practice assessor, because it pre-populates and pulls through the results. So you can't easily edit it. You can only revoke it, if that makes sense. So it's important that the process has been followed with the document to make sure all relevant sections, such as their final interview, their professional values, their episode of care, medicines management, has all been signed off and approved before you then go to that OAR section. The end of placement OAR looks a little bit like this screenshot here. So the student, you can see here it says the OAR has not yet been submitted by a practice assessor. So the student would invite the assessor through that button there. The assessor would get that email token that we mentioned previously. And then the practice assessor would see this screen here. Now, I've shown here what the pre-populated sections are. So you can see that the student, it will ask, has the student achieved the summative episode of care 1? And it will pull through that it's not been attempted because there's not a document on there that's been inputted by the student. If a student has inputted their summative episode of care 1 and it's been approved, it would highlight as the yes, and that yes would turn into a blue section. Once the PA has been linked to the end of placement OAR, they're able to go and tick this box here and say that they're happy that they've achieved the professional values in that placement, and then that will allow the academic assessor to comment and review the PAD document from their perspective. The end of programme OAR looks a little bit different in the fact that it's got more pre-populated sections, but the same principles still applying, that the student needs to invite their assessor via this button here. And again, you'll see the pre-populated fields will pull through as no if something hasn't been approved or submitted. If everything's been submitted and everything's looking good, all the pre-populated sections would be yes, and the only questions that the assessor would need to answer are the final 2 questions here. Confirming if you've been in communication with the academic assessor regarding the student's performance and status, and confirming that the student has participated with guidance and achieved all the requirements of that part to be able to progress on to their next part, or in the part 3 instant, graduate and receive their PIN. These sections, as I say, aren't pre-populated, so it is important that those are ticked so that the academic assessor can then go into the EPAD and verify that the student's document and progress them, or not progress them if they haven't done the required elements of the EPAD. So that was sort of a whistle-stop tour. From a technological point of view, if you're ever having problems with the EPAD, or you have a student that you feel isn't able to navigate the document well, then you can get in contact with us. But it's important to note that all students are given EPAD training ahead of their placements, and they're all, on subsequent placements they're given refresher training. They also have access to the video documents that we have that walk them through the EPAD. So there's always resources that they can go back and reflect on and refresh their memory. But if you, like I say, if there's issues that you're having with the EPAD, it's not working quite how you would like, you would expect it to, or the student's having problems, then you can contact the health placement team on our email address, and that inbox is monitored 9 to 5, Monday to Friday. So you can always ask us a question and we'll get back to you as soon as possible, helping you out where we can. So I will stop. I'll just open this up and stop sharing my screen. I'm not sure if any questions came through, but feel free if there's anybody that wants to ask a question about the EPAD.
I don't think there was any in the chat that I could see, but I had a few just from generally from the training. If between you all, Lydia and Rosie and Shannon, would mind just me asking a few of these before we wrap up.
Yeah.
Thanks both of you for your time and your presentations. They're really, I mean, I've learned absolutely loads, so thank you. And I think this will be a really good resource for people to use. So right, let me start at the top. So if a healthcare assistant is trained in our organisation, for example, to do phlebotomy, could they sign off a student doing phlebotomy, or does it have to be someone who's like a registered healthcare professional?
So I don't think they can, because they're a healthcare assistant.
Yeah.
I can double check, but from what I understand, healthcare assistants are a no-go for signing off the proficiencies.
The skills, yeah. Cool.
But I'll
Thank
double
you.
check.
Yeah, that's fine. And then if it was something like doing a wash or something that's not a skill, like a professional skill, that's a general care action, could they make a note to say that, or would it still be the registered professional saying, oh yes, they worked with the HCA and they washed, did a bed bath or whatever it is?
Yeah, so they could get feedback from the supervisor, could get feedback from the HCA, and they could use that to inform the decision whether or not the student was competent in that, because it's not technically a skill.
Yeah, it's just a general.
Does that make sense?
Yeah. Cool, thank you. So we've got a couple of areas in our hospice that haven't historically taken students. So our day hospice, our community CNS teams, and our hospice at home teams. So they're who we're kind of focusing on at the moment to help develop their skills. Now, a lot of them will have worked in different areas previously, like district nursing or acute trust, and have supported students there. So some of them will have their sort of either mentorship course, or is it the SLAIA? I don't know how you pronounce it. SLIAP.
The SLAIP.
Yeah, SLAIP.
Yeah.
I was like, it sounds like SLAIP. The SLAIP training. So if they've done that and they've recently supported students, and then they could brush up with the e-learning for health. Would that be sufficient for them to be a practice assessor for students that might come to the
Yeah.
hospice?
Yeah, I'd say so. If they've already mentored students and they've got their official accredited training, which is the SLAPE, or there was another one before that, but I can't remember for the life of me what it was.
I think that might be the one I did, which was called mentorship. It was like a mentorship postgrad module, like a master's module that I did at VCU.
That sounds about right.
Yeah.
But yeah, so they've got experience. So as long as they do the e-learning for health top up, they should be fine to be an assessor.
Okay, fine. Because that was my concern, obviously, because it's sort of a new area. I knew that e-learning for health is a good base, but I was thinking if you've only got that, that's not really enough, is it? You need to sort of have that experience from before to sort of build on. Fine. Okay. Thank you. Oh, so when you talk about the parts, is that a year?
Yeah.
Yeah, because there's sometimes interchangeable kind. Fine. Okay. So part 1, 2, and 3 is just year 1, 2, and 3. Fine.
Yeah.
It's just that the EPAD splits it. It will say part 1 rather than year 1. So
okay, fine.
You can use them interchangeably, but I was just trying to use the EPAD language. So
that's
people
good
don't
know.
Yeah.
And one question about reasonable adjustments, going back to Lydia and Rose for what you discussed. We had a student, this wasn't from UCB, it's from another uni, who arrived on the placement and said they needed reasonable adjustments. I think it was due to a health condition where they couldn't work the sort of shifts. They needed to do sort of their hours sort of 8 till 4 or something. But unfortunately, that meant that during the placement, they didn't get the full experience of the placement because how they do their controlled drugs round was, before, or maybe they did like 10 till 6. Anyway, whatever hours the student needed to do, it meant they missed some of the handovers, they missed MDT meetings, they missed the controlled drugs round that they usually do. So it just meant the student wasn't able to get as much out of the placement as what the placement would usually offer. So they missed out, and the hospice kind of, the feedback from the inpatient unit was that if we'd have known in advance what that student's requirements were, we might have suggested that maybe this wasn't the best placement for them because they couldn't actually get the full experience out of it because of just the timings that we use on our inpatient unit for some of our meetings and things like that. So and also they didn't know until the student turned up on the first day and said, I need this. And it was how to sort of check that with the university. Obviously you want to trust that the student's telling you the truth, but is there any sort of a system at UCB for checking that, or anything where you'd be informed in advance, oh, this student needs reasonable adjustments? Like, how would that go if it was a UCB student, is I guess my question.
So we're very fortunate at the moment that we have smaller numbers than most universities. So we do know our students on a personal level, and we do talk to each other a lot as a team. So for example, if I had a student I was a personal tutor for, and they were going out onto a placement and I knew that they would need reasonable adjustments, I would have that conversation with my student and ask them if they were happy for me to discuss it in advance. Because obviously we know where they're going in terms of placement before day one, basically. So I would ask if they were happy for me to. If not, I would ask if they were happy for the academic assessor to, that's like the link for that area, to carry that out. And most of our students are really forthcoming. They'll just say, yeah, that's fine, I understand I need it, and I understand you want the best for me, and the placement want the best for me, and this is the best way to kind of move forward.
So obviously I think that sounds great. I mean, that would be the ideal. If we know in advance, then we can sort of discuss it and work out how it's going to work best. So that's really reassuring to know. Thank you. Is there any difference in uniforms between year 1, 2, and 3 students? Or they all wear the same?
They all wear the same except for the epaulets.
Oh, fine. Okay, cool. Thank you. And the patient feedback, is that written straight onto the EPAD by the patient, or would you get them to like handwrite and then you copy it on? What do you?
So patient feedback would be uploaded via the file upload. So you'd get if it was a form that you've got, the student could take a picture of that form and upload it. Then the student could upload it themselves, but we don't ask the patients to get involved in that, and we don't ask the practice assessor to be uploading that document as such. It should be the student that's leading that.
Fine.
Yeah.
Thank you. Right, sorry, I'm just whizzing through my other question. Oh, I think you already talked about a retrieval placement versus action plan placement. So retrievals where they've maybe failed a section previously and they need to repeat it. Is that right?
So, sorry, just to jump in, Lydia might say something different, but from a placement point of view, we've got a retrieval can almost cover a retrieval of making up hours as well. So
Okay.
some will highlight when a student's coming out through retrieval through making up hours, or whether they've failed a placement and
Okay.
need to retake that. But
Fine.
from our team point of view, it will be highlighted on the report, or when we're arranging that placement, what they're coming out for on that report.
Right. Cool. So then the placement would know which one it is. Great.
Yeah.
Oh, the episode of care that they have, the student has to document. Would that be something they sort of choose, that an episode of care that they've delivered with the patient? It might be, oh, I did a bed bath for that patient and got them all dressed and ready and then did their obs or something. That would be sort of an episode of care. Or is it more like over a few shifts, or over one whole shift would be an episode? Like I just wasn't sure what they, an example of what they might use as an episode, I suppose.
So as far as I'm aware, they choose one patient, don't they, Shannon? And they focus on what they've done with that patient and how it meets the proficiencies.
Okay.
Yeah.
It's all interlinked and intertwined.
Equally, sorry, on the episode of care on the EPAD, it will give a guideline.
Okay.
It won't necessarily say what classes as an episode of care, but it tells you, gives you a bit of an indication as to what they should be looking for or doing, if that makes sense.
Yeah.
So,
and would it usually be one patient on one shift, or it might be the same patient they've looked over after a few shifts?
So it's normally one over one shift, and then if they did that for formative, they could still do the same student for summative, but it might be a different episode of care that they've done with them.
Oh, that makes sense. Thank you. And then, sorry, I'm nearly through my questions. I'm trying to jump in. With you said you could like send communications back and forth from the EPAD. Would you advise that all communications are done by that route, so that it's sort of all contained in the EPAD?
Tricky question, really. Yes and no. If you're wanting information to remain sort of confidential and it's between just one party, I wouldn't put it onto the EPAD, because it can be seen by people that have access to that student's record.
Fine,
Does that make sense? So if you want, if you've got some concerns and you just want to talk something through, first of all, with somebody in the university, I'd probably recommend emailing us directly. I'd probably use a communication section more to say, I don't know, hi Joe Blogs, you're midway through your placement and you've not submitted something to me. That sort of dialogue would probably be better for that communication stall. But confidential or trickier bits of information, you're probably best just to use your normal channels of email.
Fine, just more direct call. And I noticed when you were showing on the EPAD that the same proficiency had multiple dates next to it. So you can sign it off more than once if they've demonstrated it more than once?
You would recommend, no. So they won't, for each proficiency, they only have to do it once. So that student that's done 3, they can practice it again, but really and truly, if they've done it once, they don't need that assessor to keep going in and signing it off. They're more than welcome to practice it multiple times, but it only needs to be signed once.
Fine.
The only time, obviously, if they've attempted something and haven't passed it, then yes, they would need to redo that. But I think that students just keeping practicing and giving the PA more work to do. But we do tell students it only needs to be signed off once, but I think sometimes when they're repeating things, they think they need to,
keep showing. Keep showing. And then my last thing was about you mentioned, I think this might have been Lydia and Rosie, mentioned supervision and assessment teams. Was that in relation to, in the practice area, you'd almost buddy up supervisor, assessor with like a student or a couple of students and sort of having them work in a team so that they can all kind of cross share? And is that what you meant?
You can do that if that works for you as a team. Obviously, it's whatever works for you out in clinical practice. If you say that you're going to have, I don't know, 6 students in one clinical area, so you're only going to have 2 practice assessors, but everybody else is a practice supervisor, then you don't really need that team. But if you've got like a larger area and you're only going to have limited practice assessors, you might have to start buddying them up so they know who's responsible for who. Or the practice assessor knows, okay, so I've got 5 supervisors that I'm responsible for, and yeah, I'll support the other guys, but these are the 5 that I've got to worry about the students. Does that make sense?
Yeah, that makes sense. Yeah, I think for us, our areas will be fairly small, so I think probably we won't need that system, but it's a good option if we need it. So our areas will be those 3 sort of community areas we mentioned. What we were hoping to do was for a 6-week placement, for example, maybe get them to spend 2 weeks in each of those 3 areas, because they cross over a lot. All the patients they're dealing with are in the community setting, so the patients they're seeing, for example, might be under the community CNS and hospice at home. So both of those teams will be visiting the same patient at home, but doing different roles. And then the student could spend a couple of weeks with the CNSs, a couple of weeks with hospice at home, a couple of weeks with day hospice. I think the concern we've had students previously just in one of those areas was that they didn't get a broad enough chance to sign off those proficiencies, because the nature of the work. In inpatient units it's much easier, but we've only got small inpatient units, so we can't accommodate all of the students there. And we definitely do the sort of experience day where they go down to the inpatient unit for a day or 2 during the placements. They still get access to that environment, but it would be sort of almost, we'd probably swap like an inpatient unit student with a community student and then do a trade almost for those days to try and give them a broad experience. So that would be probably how we do it, but I guess we'd need to have one main supervisor to provide that continuity through the placement as a whole.
It would be one main assessor.
Sorry, assessor, yeah, sorry,
yeah. As long as they've got that one main assessor, and also even if you've got small teams, as long as your teams are able to communicate to get that document done, because quite often it's not necessarily a common problem, but if a student's going to lots of different areas and you've got a student that's trying to get the parts of the document signed off by one team and then another team, and then there might be 4 weeks into the placement and they've done the first 2 weeks, that person still hasn't signed it off. You need to be able to that communication to the team to get things signed off, because it's quite stressful for a student to be in a totally different area and they're still waiting for that area to sign something off.
Yeah, so I guess we'd have to structure it. Maybe we'd have almost like a lead placement area, and then maybe they'd just spend less time with the others. They can still experience all 3, but maybe we have a nominated lead placement, and then that would also be where their practice assessor is based, so that they're the sort of key person who remains sort of consistent through their placement. And then they can liaise with the areas depending on how they've got on.
Yeah, that's what I'd recommend.
Cool. Great. I think that was all my questions, so I won't take up any more of your time.